Hello, welcome to the fourth module of our five-part training on rapid rehousing, reducing homelessness using a rapid rehousing approach. My name is Kay Mosier McDivitt. I'm a capacity building associate with the National Alliance to End Homelessness, and I'm going to be narrating this fourth part of the training series, which is on supportive services. This is going to focus on how and where to provide supportive services as part of the rapid rehousing approach. This module has two activities built into it. When we come to a place where it makes sense to do these activities, we will let you know and explain what the activities are. If you choose to do the activities at that time, you can pause the training after you have listened to the instructions and then resume it once you've completed the activities. Or feel free to do the activities on your own time after listening to the entire presentation. If you do have any questions about this training or about rapid rehousing in general, please feel free to send them to the center at naeh.org. So now we're going to get started. As a reminder, there are four key components of rapid rehousing. The first module in our series covered the housing barrier assessment component, and then the second module covered the housing location and landlord recruitment. Our third module covered time-limited subsidies, and then this is the fourth module in our series, and it's covering the housing stabilization and supportive service component of rapid rehousing. I'm going to start by talking about what supportive services look like in the rapid rehousing approach. These supportive services happen after households move into their own housing, and they focus on housing stabilization. As you think about how to develop the supportive services component of the rapid rehousing program, it is important to remember the information that we covered in the first module on the housing barrier assessment. If you recall, the information that you gathered during the assessment is related to two areas. First, the barriers to obtaining housing, and then the barriers to maintaining housing. While your initial focus is on those barriers to obtaining housing, once you've gotten people into housing, it's time to address the barriers that will impact their ability to maintain it, such as perhaps substance abuse or mental health issues or lease compliance problems. In essence, the supportive services provided as part of rapid rehousing are those services that each household will need to remain stabilized in their housing. It is important to remember that just like the subsidies, the supportive services for each household are not a one-size-fits-all. Each household does bring their own resources and individual strengths to the table, and they're going to need different supports and services to maintain their housing. Supportive services will also need to be flexible as your client's situations may change. The first thing to remember in developing your supportive services is that the services are consumer driven. The supportive services also need to be focused on housing barriers. As you develop a housing plan for each individual household, it's important that the plan identifies both the household's strengths to maintaining their housing as well as the barriers. Resources and services that each individual household will need to access to maintain their housing should be identified. Clients are involved in the development of their plan, and they make the choices about the services they want. Remember, as you provide the follow-up services after housing is located, a client situation can change and you will need to revise the plan accordingly with new and different services identified and leveraged, again with the client choosing the services they wish to participate in. So there's three things to think about in supportive services. First, services are voluntary. Often programs have required that households participate in a variety of mandatory program services. In rapid rehousing, service participation is voluntary. The services that are available to households in housing should look the same as the services that can be accessed when in emergency or transitional housing programs. However, the difference is that those services are offered to the household in their own home environment, and their participation in those services is voluntary. As we talked about during the landlord module, households in rapid rehousing have a lease just like anyone else, and as long as they abide by the terms of their lease, they should be able to maintain their housing. Services provided should help them focus on what they need to do to maintain that lease, but their lease should not be dependent upon mandatory service participation. One way to think about this is that the role of the case manager in rapid rehousing is to help the client obtain permanent housing. But once the client is housed, it's their responsibility to sustain that housing. By communicating to the client that they need to maintain their own housing, then the role of the program case manager is to assist the client to leverage the services that they, the client, have identified that they will need to maintain their housing. In this type of relationship, the clients is most often will willingly and voluntarily participate in their case management plan since it's their plan, it's what they've developed, it's what they want, and it's also what they know they need to be able to maintain their housing. Also, supportive services are home based. This is a new concept for many programs who have often provided services only within the organization in a site based model. But the success of rapid rehousing is to help a household stabilize in their community, in their own home, and then leverage the supports that they need in that community to maintain their housing. Home visits and home based services allow the opportunity to observe how the household is doing in their own environment, and again, it aligns with a client focused approach. And finally, services are client driven. So let's talk a bit more about what this client centered and client driven approach means. First, client driven means that the client makes the decisions about what they want and what they need. They set their own goals, and then the role of the program is to help them connect with the services that they need to achieve those goals. A client centered process is at the core of home based case management. Services are focused on what works best for the client rather than what works best for the program. The services are also strengths based and they focus on building upon the strengths and resources that each client brings. And as mentioned previously, services are focused on housing stabilization. In the module on subsidies, Kim mentioned that the goal of rapid rehousing is not to alleviate poverty, but it's to help persons leave the homeless system and then not re enter the homeless system again. So it's really important to remember that same concept when you think about housing stabilization. Your supportive services should focus on what services are needed for the client to abide by the terms of their lease to maintain their housing and not re enter the homeless system, but that you may not be able to alleviate all the issues of poverty in their lives. So, and finally, and perhaps most important, the key for supportive services component of the rapid rehousing program is not to provide all of the services within the program, but rather it's really important that you're leveraging the mainstream and community services to create a supportive system network within the client's new neighborhood and within their community. For most of us, having a good support network within our community that we are able to connect to is really key in helping us get through difficult times in our own lives. And this is really an important concept to remember for rapid rehousing. It really is a disservice to folks in our program if our program ends up providing everything a client needs. In some ways, then that's going to create a cycle of dependency if our clients keep coming back to us whenever they have a crisis because the program ends up being the only support system they have. So what we need to do in our programs is help our clients create this larger network of supports within their community, and that is going to be a key component of the supportive services in your rapid rehousing program. Let's think a little bit more about plans and visits. It can be difficult to understand how the concept of home visits and voluntary client-driven services can work together. We talk about how providing case management services through home visits is a key component to helping clients stabilize and maintain their housing, while at the same time, voluntary services are also part of the program. So we often get asked, well, what if a client says no to home visits when one of the things that we've done when leveraging a landlord to rent to that particular individual is offering the home visits as part of our program. So client driven means that the client has ownership over when the visits occur if part of the agreement with the landlord is that there would be those weekly home visits for a period of time. Working with the client to remind them that one of the reasons the landlord rented to them was the fact that there was going to be home visits, but offering to them that you're going to make it work for them. What's going to work best in their schedule? Often clients have certain times of day that work better for them, as all of us are. There are times that we want to have ownership over our environment. So giving clients that opportunity then will allow them to more voluntarily work with you within the program. And likewise, when you develop your plan with the client, focusing on what strengths they have to maintain their housing and then helping them to link to the services that they want and recognizing those strengths that they have really goes a long way. And those clients welcoming the opportunity to voluntarily engage in the services offered and in their service plan. So one of the things I just wanted to talk a little bit about is this focus on stabilization. And one of the ways you can work with your clients on this to develop their plan is to help them really look at what does their lease say, and then a little bit about how they're going to pay for their bills, and then ask them what they think they can do to maintain their lease, how they're going to pay for these things, and help them engage in identifying what they can bring to the table, how they're going to do this, and what they think they need. So again, when you focus on stabilization, you're going to, and the development of the stabilization plan, you're going to focus on their responsibilities to maintain their lease, what it says about their living arrangements, and how they can make sure that they maintain the correct living arrangements to abide by the lease. You want to really focus on their neighborhood familiarity, because that's really important to engaging a lease, their benefits in employment that they're going to need to pay for their apartment, helping them set healthy boundaries with family and other people that may want to move in if it's going to end up having them not abide by the terms of their lease. You also want to really focus a lot on their resourcefulness and really let them know that they're very resourceful and that they have a lot to bring to the table, and then just focus on whatever else they may need for their stabilization. So I've focused a lot and covered a lot of information on the concept of voluntary home-based client-driven stabilization services. But as I mentioned earlier, perhaps the most important supportive service component of rapid rehousing is the partnering with and leveraging of mainstream and community services to create a supportive system network within the client's new neighborhood and community. This linkage to existing community-based and mainstream supportive services is something that needs to be developed as a critical program component and then individualized for each household in your program. So when you think about families being in the center of all the resources, think about all of the different connections that each individual household can make in the community. One of the contributing factors to folks becoming homeless when they have a housing crisis is their lack of a support system in the community and not knowing who or where to go to, or just having no family or community network that can support them. So in light of this, one of the most important roles of supportive services in rapid rehousing is to link your households to all those existing providers and community supports that can meet their needs and goals that they have identified to maintain their housing. So in essence, a key role of case management in your rapid rehousing program is to develop those partnerships with community and mainstream providers. So it means thinking outside the box of traditional social services. So if you look at this chart, you can just think about what are all the different things in that particular household's neighborhood that already exist that they have identified they may need that you can start connecting them to. For example, if one thing a family struggles with is socialization for their children, there are a lot of faith-based organizations in the community that often offer children's programs during the week. So how can you help connect and leverage that particular thing within the local churches or faith-based community that may help them with their children's socialization? So helping your clients connect with community and mainstream resources that impact their goals, like the food pantries, assistance with bills and finances and goods, counseling, church, vocational training, etc. All of that is going to really have a huge impact on their feeling connected to their community and their housing stabilization, and give them that network so that after the program is no longer working with them when they have a crisis, they're not going to end up back in the homeless system again. For those of you who are doing the interactive activities with this training, now would be the time to do the activities for this module. There are two activities, one for identifying employment and income supports and another for identifying community supports. Each of these exercises has its own activity sheet to complete, but they basically follow the same instructions. These exercises are intended to help you create a better strategy for providing housing stabilization assistance for recently rehoused families. So answer the questions for each of the topics on first employment and income and then on community supports to identify the partners you need to engage and then create a plan for strengthening these supports for your program. When we do this activity in person, we typically give people about 10 minutes to complete each of the activity sheets. So if you want to do the activities now, you can pause the training and then restart it when you're ready to continue, or you can continue the training and then do the activities at the end or at another time. So the last thing I want to cover now is the role of the case manager. I often find that by reframing the role of the case manager to one of a broker that helps the clients connect with resources in the community rather than being a problem solver is a significant change for programs. Some programs have titled this role as the service coordinator rather than calling it a case manager role, since the core component of the role is to link clients to the mainstream resources and leverage the community supports and services that they need. So, as well as helping them identify the strengths and resources to maintain housing and meet their short-term immediate goals. So in conclusion, remember that supportive services in rapid rehousing are client-driven, home-based, and are focused on leveraging the existing network of services and resources and supports that exist in the community and the client's immediate neighborhood. So that concludes the fourth module on supportive services of our rapid rehousing modules. The last piece in our rapid rehousing module series is a final piece on outcomes, and that will explore data supporting the effectiveness of rapid rehousing and provide examples of communities that have successfully implemented the model. So we hope you'll join us for the last of the four parts. And if you did not review the first three modules, which were defining rapid rehousing and creating housing barrier assessment, the landlord recruitment, and the developing the subsidies, that you will take the opportunity to view those modules as well. So we thank you for listening to this module, and again, if you do have any questions, please feel free to send them to the center@naeh.org. I hope you found this information useful, and thanks again for your time.